Question 1. A patient with amyotrophic lateral sclerosis becomes aphasic. Which of the following should the nurse expect? Option A, normal cognitive function. Option B, inability to process information. Option C, increasing loss of memory. Option D, disorientation to time and place. The correct answer is option A, normal cognitive function. Normal cognitive function. Patients with amyotrophic lateral sclerosis, ALS, typically experience progressive muscle weakness and atrophy, but cognitive function often remains intact. While some individuals with ALS may develop frontotemporal dementia, the majority retain their cognitive abilities, which allows for normal reasoning and comprehension even as motor skills decline. A. Normal cognitive function. This is the expected outcome for most patients with ALS. Cognitive function is generally preserved, enabling patients to understand and process information despite their physical limitations. This characteristic is essential for effective communication and interaction with caregivers and healthcare professionals. B. Inability to process information. While aphasia may affect a patient's ability to express themselves verbally, it does not necessarily indicate an inability to process information. In fact, many patients with ALS can still comprehend language and engage in complex thought processes, which underscores the distinction between motor function and cognitive capacity. C. Increasing loss of memory. Loss of memory is not a typical symptom associated with ALS. Cognitive decline may occur in a subset of patients, but the majority do not exhibit significant memory impairment, making this answer incorrect. Memory function is generally preserved in ALS, reinforcing the expectation of normal cognitive abilities. D. Disorientation to time and place. Disorientation is not a common feature of ALS. Patients usually retain awareness of their environment and personal circumstances. Any disorientation that occurs is more likely related to the stress of living with a progressive disease rather than a direct consequence of ALS itself. Conclusion. In summary, while patients with amyotrophic lateral sclerosis can experience aphasia, they typically maintain normal cognitive function. The preservation of cognitive abilities allows individuals with ALS to process information and engage meaningfully, even as their motor functions decline. Understanding this distinction is crucial for providing appropriate care and support to these patients.